Together today, we remind you that reconciliation belongs to each and every one of us, as individuals, as governments, and as citizens.
Tonight, the TRC final report, 5 years later.
There's a lot of misinformation out there, and so I really encourage our people to look at these scientific studies.
And concerns over COVID-19 vaccines. Good evening, welcome to APTN National News. I'm Dennis Ward. The Truth and Reconciliation Commission's final report came out 5 years ago, but former TRC commissioners are criticizing the Liberal government, saying the feds are dragging their feet on implementing the calls to action. The Prime Minister responded to these allegations, and Jimmy Pashagumskum spoke with a professor at Carleton University on their response to the calls to action.
Former TRC commissioners, like Murray Sinclair, are skeptical of federal progress. But on Tuesday, Justin Trudeau said his government is making headway.
As much as Ottawa might want to put forward the answers and move forward very quickly, it can't be that way. We need to do this in partnership, hand in hand with Indigenous communities who need to determine their future.
Trudeau said his job is to support, resource, and accompany Indigenous people on the path to reconciliation. Meanwhile, Ottawa's Carleton University is replying to the calls to action. One of them has been running for the past 2 years. The university calls them Indigenous Collaborative Learning Bundles.
They're actually living bundles of knowledge. So we have a lecture provided by myself or other Indigenous faculty at Carleton or elsewhere, or community knowledge experts. And then there's also an interview with a knowledge keeper, Indigenous knowledge keeper, that really brings the content of the lecture to life.
Carleton is applying the bundles in over 50 classes this term across all disciplines. Professor Keontae Horne-Miller feels it's her responsibility to bring this knowledge to the rest of the university.
I come from a people that are know diplomacy. My people, the Kanien'kehá:ka, are part of the Haudenosaunee Confederacy, and we have a long-standing practice of building bridges between our culture, our nation, and other nations. So
Horne-Miller said they are ensuring that Carleton University graduates leave with the skills to have the difficult conversations around reconciliation, which comes straight out of the TRC's calls to action.
The call is really start to learn the history, start to engage with that difficult history, and start to fix it, fix those relations.
Horne-Miller says the learning bundles address the lack of knowledge of Indigenous peoples. And as far as the university is concerned, that work is ongoing. Jimmy Pashagumskum, APTN National News, Ottawa.
To other news, it's been 150 days now since land protectors from 6 nations occupied a site slated for development near Caledonia, Ontario. To mark the occasion, 1492 Land Back spokesman Skylar Williams led a tour of the site. It's been the center of tension between the occupiers and Ontario Provincial Police. Despite court injunctions asking them to leave, Williams showed that land defenders are here for the long haul. Several small houses have been built, and Williams says they are ready to stay the winter. He gave this reason for opposing development in the area.
The way that we live is quite a bit different than the covering everything in concrete and asphalt and calling that progress. You know, for us to be able to have 10 by 10 space to be able to live and sleep in, to have the ability to let the wildlife come back here for the earth here to regrow and heal itself, and like that's what progress is for us.
Okay, we're going to step aside now for a quick break. Coming up, concerns over getting the vaccine.
Together today.
And I think, again, it has to do with the treatment that they've had through the years.
Welcome back. As one of the COVID-19 vaccines makes it to the provinces this week and into the arms of frontline workers and the elderly, a conversation is playing out online, with many, including Indigenous people across the country, voicing their concerns over this vaccine. For some, it brings up concerns of pandemics past. But Indigenous leaders, health professionals, and historians are urging people to do the proper research. Brittany Hobson explains.
This was a scene in Quebec and Ontario where healthcare workers and the elderly eagerly lined up to be the first to receive the Pfizer COVID-19 vaccine in the country. And while many view this as a momentous occasion, some are voicing their concerns. All it takes is a quick scroll through Facebook or Twitter to find people are divided when it comes to taking the vaccine. This is especially prevalent in Indigenous communities. One person writes, "I feel that the vaccines are being given out to First Nations to use us as lab rats. So in case anything goes wrong, the Canadians won't have to suffer." Another writes, "I don't trust the government at all. #genocide. On the other end, some are taking caution. It depends on your level of risk and how much information you have on the safety and efficiency of the vaccine," one person writes. While another says, "I'm not about to run out and get it ASAP, but if I see it's working out well, I have nothing against it." These conversations aren't surprising to Michelle Dreger, a Métis professor of community health sciences at the University of Manitoba. Dreger previously did H1N1 research with urban First Nations and Métis. These comments were similar to what she heard at that time.
There was a considerable amount of distrust with respect to the pandemic H1N1 vaccine, particularly when it was initially rolled out. And a lot of the concerns that were being raised by participants was that they felt that the vaccine was being tested on them to make sure that it was safe before it would be given to the white guys.
In the case of H1N1 in Manitoba, Indigenous people were prioritized to receive the vaccine after severe outbreaks in the Island Lake region. But this decision didn't provide the relief it was meant to, because people feared they were being tested on.
I guess when you think about historically, when have people of First Nations, Inuit, and Métis ancestry ever been prioritized to receive anything good before? So some of the concerns that citizens were expressing made sense in that context.
History is a basis for many people's fears. In the 18th century, there are stories of settlers giving smallpox-infested blankets to Native Americans. In sanatoriums, residents spoke of medical testing and experiments. And most recently, a class action lawsuit was launched after several Indigenous women say they were sterilized without their consent. Dr. Veronica McKinney says these instances and ongoing systemic racism within the healthcare system need to be addressed.
And I think, again, it has to do with the treatment that they've had through the years. And it kind of speaks to me more about how I wonder if we're actually doing a good enough job on education. And it's not just, education isn't, it's good for you, take it, but really helping people to understand what is this and what are some of those little nuances.
The Assembly of Manitoba Chiefs hosts weekly Facebook Live meetings on the pandemic. The vaccine has been top of mind for the past 2 weeks.
I think the risk of Indigenous people being rushed into taking the vaccine would be significantly lower than any delays in getting the vaccine available for Indigenous peoples.
Indigenous peoples are considered a priority group for the COVID-19 vaccine, but it could be weeks before communities see it because of the limited amounts and storage requirements. In the meantime, leaders are urging those with concerns to seek out reliable sources of information.
There's a lot of misinformation out there, and so I really encourage our people to look at these scientific studies, to look at the scientific journals, to try and wade through them to really understand what the facts are.
So far, the Pfizer vaccine is the only one approved by Health Canada. The federal government announced they are on track to approve the Moderna vaccine. Health Canada has said people with allergies to any ingredients in the Pfizer vaccine should refrain from getting it. Brittany Hobson, APTN National News.
Quebec has tabled its so-called zero-tolerance plan to fight racism throughout the province. But as Lindsay Richardson explains, those closest to the cause say it fails to zero in on the root of the problem.
It took Quebec 6 months to come up with a plan to fight systemic racism. And when its anti-racism task force unveiled it on Monday, they avoided calling the problem by name, despite promises to fix it.
Watch what's going to be happening. You're going to see real results because you're going to see real actions in place.
The task force assembled in June. After consulting more than 50 organizations, their zero-tolerance action plan makes 25 practical recommendations. For Indigenous groups, there's definitely déjà vu.
When you come down to the real actions, when you come down to what you really need to put in place, all those actions basically are the same. And they're related to the same sectors.
Some aspects of Quebec's approved plan mirror the Vienne Commission final report. Starting an awareness campaign, for example, was call to action number 20. Quebec says they'll improve education and cultural training resources, something the Vienne Commission also called for. Additionally, Quebec is promising an end to random police street checks, a practice found to disproportionately target Indigenous people. That part of the plan is good news. But the Vienne Commission report, Joyce's principal, and the Assembly of First Nations Quebec-Labrador are all calling on Quebec to admit its issues with systemic racism. Speaking with CTV News in the afternoon, the Premier didn't budge.
Quebec is one of the places in the world where we have the less racism, but still we have to continue to work against racism, but we have to be proud of our situation.
Without a budget or specific framework, the Atikamekw Nation says this new plan leaves more questions than answers. In the words of the AFNQL, it's piecemeal. Quote, this series of measures may not have a lasting effect if we do not address the root causes of racism and discrimination, according to AFNQL Regional Chief Ghislain Picard. Quebec says they will hire a minister specifically to fight racism and will continue working with civil and human rights groups. Meanwhile, Indigenous Affairs Minister Yann Lafrenière urges patience.
We've been announcing cultural safety in hospitals. We've been announcing also construction of residence for students. We've been announcing also training for police officers. So we're a government of actions. So far we're doing actions, and people should judge us on actions.
The province has yet to set an official deadline for these changes, though many believe they're long overdue. Lindsay Richardson, APTN National News, Montreal.
As we mentioned off the top of the show, today is the 5th anniversary of the release of the Truth and Reconciliation Commission's final report. Here's Daryl Stranger now with the commissioners of that report.
For the first time since the release of the Truth and Reconciliation Commission's final report, all 3 commissioners were together, albeit virtually. The commissioners joined APTN in Focus for a special show 5 years after the release of their final report. They say they reconvened to renew the sense of urgency, purpose, and unity in the calls to action.
Together today we remind you that reconciliation belongs to each and every one of us as individuals, as governments, and as citizens. Reconciliation is not dead unless we kill it through our own inaction.
The TRC spent 6 years traveling around Canada to hear from the people who had been taken from their families as children and placed into residential schools. It is estimated that over 150,000 children attended residential schools for over a century. It was the Commission's role to document these stories. Garnet Andrikaneb is a survivor of residential school and is cautiously optimistic about what the future might hold.
I see a lot of hope, but and as significant milestones have happened, I've also seen some signs of change. And I really put a lot of faith in those signs of change. And so I have to count on that. But as I say, it's been really slow, I think, in so many ways.
Murray Sinclair says change is not supposed to happen overnight, but would have liked to see more progress at this point.
We did not and do not expect change to happen overnight. It is, however, very concerning to us as commissioners that 5 years later, the federal government still does not have a tangible plan for how they will work towards implementing the calls to action.
Minister of Crown Indigenous Relations Carolyn Bennett says the establishment of a National Council for Reconciliation is top of mind.
I think, as we've heard from the commissioners, that we need to accelerate the pace of setting up that National Council for Reconciliation so that there is that arm's length body of really the accountability, not only for the 94 calls to action, but also all aspects of reconciliation.
Everyone agrees that it is not too late to come together as one and work towards reconciliation and honor the truth.
All the kids entering kindergarten now who have their first orange shirt day, that at those next anniversaries know exactly what we're talking about and will never let anything like this happen again.
Daryl Stranger, APTN National News, Winnipeg.
Well, time now for one more quick break. When we come back, slow internet speeds in the territories has a lot of people worried.
So much of the work that we do, even as our service, is reliant on the internet.
Welcome back. Time now for our photo of the day. And it's a good one. How's this for a scene right out of Canada? Sent to us by Brooke Papanikis. And they're bringing home their Christmas tree on a snow machine near Cross Lake, Manitoba. Picture whoever's driving that wearing a Santa outfit. Be sure to send us a picture when it's all decorated. We want you, the viewer, to send us your photos to share at aptn.ca, and your photo might be our next photo of the day. Now let's take a look at tomorrow's weather forecast. Starting on the East Coast, 0 with snow for St. John's, -7 and snow in Halifax, 10 below in Nain, -2 in Cartwright, 14 below in Montreal, sunny, and -24 for Chibougamau, -6 with snow in Toronto, 3 below, and flurries in Sault Ste. Marie, -2 with snow for Thunder Bay, 6 below with flurries in Sioux Lookout, -12 and snow in God's Lake and Norway House, -3 with snow in Winnipeg, 7 below with snow in Dauphin. Snow and -5 for Regina, sunny and 9 below in Saskatoon. -27 in Uranium City and Stony Rapids. Picking up in northern Alberta, -23 for high level, 15 below in Fort McMurray. +2 for Medicine Hat, 4 above and sunny in Lethbridge. Showers and 7 above for Vancouver, 9 and rain in Victoria. -13 with snow for Dease Lake, 3 below and snow in Smithers. -28 for Old Crow, snow and 13 below in Whitehorse. -36 for Yellowknife, 27 below in Norman Wells. -21 with snow for Sax Harbor, 27 below for Colville Lake. -35 in Baker Lake, 32 below for Whale Cove. -18 in Resolute, 25 below with snow in Igloo Lake. Unlimited internet has just recently been rolled out in a few communities in northern Canada. And while it's a privilege for some, for most northerners, data caps and overage charges continue to be the norm. Our Sarah Connors reports.
Everybody's happy in the house, which is good.
Like many northerners, TJ Stewart's family has been using the internet more because of COVID restrictions.
Well, I've been using way more since COVID started, staying home all the time.
But because of data caps, the Casca man has to be careful about how much internet his family uses.
We had a bill around $200 over. That's because I have a daughter too. She was downloading stuff. I had to lock up her iPad though.
But now they can stream as many games as much as they want. This month, Northwestel, Northern Canada's major internet provider, introduced unlimited internet to 7 communities in the Northwest Territories, Northern BC, and the Yukon, including Whitehorse, where Stewart lives.
It's about time, man. Like, it's a great thing.
So much of the work that we do, even as our service, is reliant on the internet.
But 500 kilometers north in Dawson, there's no unlimited internet. Jen Gibbs, who works at the Dawson Women's Shelter, says with COVID restrictions often forcing women to be home with their abuser, reliable internet is crucial.
If women don't have access to a crucial tool like a phone or a laptop with internet access, this may create more danger for them.
Without unlimited internet, the shelter is forced to restrict access to the many Indigenous women that stay there.
So the really unfortunate thing has been that we're just not able to offer our Wi-Fi password to folks who are accessing service with us because we're already paying such an astronomically high rate.
Another frustration for Gibbs is that northern internet costs double, sometimes triple, what most Canadians pay.
It's not uncommon that we chat with our service users and they say, you know, I'm making a choice between paying my rent, putting food on the table for myself and my kids, or having internet access.
Northwest Tel VP Tammy April says high infrastructure cost in the north limits what they can provide.
That's a whole lot of kilometers that we're covering with fiber and not a lot of people.
But Gibbs says everyone should have access to unlimited internet, not just those who can afford it.
So much of our lives and the business of day-to-day existence has shifted to online spaces.
Northwest Tel says all northern communities they service will have unlimited access by 2023. And TJ Stewart says it's worth the wait.
Something to look forward to. I feel bad for them. I really do.
Sarah Connors, APTN National News, Whitehorse.
An investigation into British Columbia's healthcare system found hundreds of examples of racism and implicit bias against Indigenous peoples. 52% of Indigenous healthcare workers experience racism from their colleagues. Mary Ellen Turpel-Lafond was the investigator, and she discusses her findings on tonight's episode of Face to Face.
Especially for the Indigenous healthcare workers, I found that their stress, their employment has been adversely impacted because of the racism they've experienced. And I even found multiple cases of where the racism was career limiting, meaning someone should grow and develop in their role in their job. They should be supervising a unit, for instance, or advancing. But the racism had actually limited their career chances and their opportunities.
You can watch that entire episode of Face to Face right here in just a few minutes. That's all the time we have for your APTN National News for this Tuesday. For news anytime, visit our website, aptnnews.ca. I'm Dennis Ward. Thanks for tuning in. Have a great night.